Hello, my name is Destiny. I am a student here at North Carolina Wesleyan College, and today I'm going to be discussing ACSM's pre-participation screening algorithm and how to use it. Alright, before we get started, you have to understand what the pre-participation screening algorithm is. ACSM's pre-participation screening algorithm was designed to identify participants who are at risk for cardiovascular complications during or immediately after anaerobic exercise. This algorithm consists of three components. First, we identify individuals who participate in regular exercise and those who do not. In order for an individual to be considered someone who participates in regular exercise, that person must perform a planned, structured physical activity for at least 30 minutes at moderate intensity at least 3 days a week within the last 3 months. This can also be determined through a physical activity readiness questionnaire or the PARQ Plus test. This is so that we can identify individuals who require medical clearance prior to beginning an exercise program. Once this is done, as a part of the pre-participation screening process, exercise professionals should always ask if the individual has been diagnosed with any cardiovascular, metabolic, or renal diseases. This is a part of the second component. As well as in this component, exercise professionals should be aware of any signs and symptoms that suggest cardiac, peripheral vascular, cerebrovascular disease, type 1 and 2 diabetes mellitus, or renal disease. From here, we move into the third component, which is identifying the desired intensity. This is important as sometimes vigorous intensity can trigger cardiovascular events. So it's important to know that a person's desired intensity is something that is safe and achievable. The following pictures are an example of what the PARQ Plus test looks like. The PARQ Plus test is updated yearly, but for the purpose of this video, we will be using the 2014 edition of the PARQ Plus. The PARQ Plus test is also considered a self-screening tool and is often used for individuals who wish to initiate an exercise program. Once an individual is classified as someone who does not participate in regular exercise or someone who does participate in regular exercise, the following diagrams are used. Starting with individuals who do not participate in regular exercise. If no cardiovascular, metabolic, or renal diseases, and no signs and symptoms suggestive of cardiovascular, metabolic, or renal diseases are found, no medical clearance is deemed necessary. And light to moderate intensity is recommended, and you can gradually increase to vigorous intensity following the ACSM guidelines. Now, if cardiovascular, metabolic, or renal diseases are found, but with no signs and symptoms, medical clearance is still recommended. And once medical clearance has been given, light to moderate intensity is recommended, and you can gradually increase your tolerance following the ACSM guidelines. With that being said, if any signs and symptoms of cardiovascular, metabolic, or renal diseases are found, regardless if any cardiovascular, metabolic, or renal diseases are known, medical clearance is still recommended. And following medical clearance, light to moderate intensity is recommended, and as well, you can gradually progress following the ACSM's guidelines. If an individual is deemed someone who participates in regular exercise with no prior cardiovascular, metabolic, or renal disease, and no signs and symptoms, no medical clearance is necessary, moderate to vigorous intensity is recommended, and of course you can gradually progress following the guidelines. Now, if this person is deemed someone with known cardiovascular, metabolic, or renal diseases and are asymptomatic, medical clearance is needed but it is not needed for moderate intensity exercise. It is only needed and within the last 12 months before engaging in vigorous exercise. You can continue with moderate exercise, but following medical clearance, you can gradually progress. Now, if this person shows any signs and symptoms suggestive of cardiovascular, metabolic, or renal disease, regardless if they are known or not, discontinue exercise and seek medical clearance. You may return to your exercise program following the completion of medical clearance. This figure is an example of what the screening questionnaire would look like that would be filled out by exercise professionals. This is done to determine any signs and symptoms of cardiovascular, metabolic, or renal diseases.